Countries try to preserve public health measures. Where cutbacks happened, it was mostly in the clinical area, in hospitals, in cash benefits, in some of these areas. But most countries and most health sectors in these countries have been affected. I think what we learn from that is that we need to prepare better. We need to preserve access, particularly for the poor, for those who are less fortunate in society. Because if we don't do that, in the end, the costs will actually be higher for the system and for the health sector at large.
I'm a student of international healthcare management, and I came here because I'm interested in knowing how European countries are actually dealing with the crisis, and especially the former East European countries. They've always had a bit of a problem, and it will be interesting to know if they've made any reforms, if they're changing how they've been doing things, and probably if the Western countries could learn something about that.
What is good about an app is that you can tailor it to the person that needs it, that who can install this application on their smartphone and then on daily basis get advices or tips and tricks how to deal with their disease. Because and we need a mind shift, because there's such a stigma, a taboo around burnout that should be changed. And we think an application is a good way to do this.
Medicine is not healthcare, it's sick care. It's what we do after someone has become sick, whereas the potential of using various forms of new technology, IT, information technology, we can actually deal with healthcare. The power of a chip doubles every year and a half, which in reality means that the cost of computing drops dramatically, continues to drop, and the more we can devote IT to health issues and to managing health, the cheaper, in fact, healthcare will become.
What happens when temporary cuts made in time of crisis become permanent?
I've heard that austerity and crisis were very difficult for everyone, but I think policymakers have to protect health from market forces, and we need to go forward to new challenges like climate change and like how to deal with new technology for health.
Yeah, we are right now fighting for a policy that makes investments in the future, and this means investments in health, education and all the social issues. Because I think if you do not invest in health, you really have to pay it back in the future very much, not only in money, but also in people suffering. So I think prevention, immunization are topics that have to be on the daily agenda.
In a situation when the budget is tight, ECDC would like to provide evidence for governments to make the best decision regarding, for example, vaccination programs. We know that some vaccines are not cost effective and some are. So it's important to make the best decision here.
We have to weed out the inefficiencies, and we have to make sure that we concentrate on prevention, keeping people out of hospital beds. Prevention avoids sicknesses, and therefore our policies has to emphasize wellness.
Is this crisis ever going to end? Is this the new normal?
How are cuts decided and by whom? Who is accountable? What criteria do they use?
Well, that's the $1 million question, how to solve this. When we look back now into history, we see that the health sector was more reacting than proactive. So they faced the decisions of other ministries or even the Prime Minister. In some countries, you have self-regulating bodies, but they depend on taxpayers' money or insurance premiums too. So new ways are needed to deal with this. Let's see how they will react.
Well, much more than they're recognising, actually. We know, obviously, what is going on in countries such as Greece and Portugal and the countries that are making the headlines. But actually what has happened is that economic power is being concentrated in Brussels. So when national ministries are choosing to remain disengaged in some of these decision-making processes, we're actually building a problem that is going to have ramifications for the next 20 or 30 years. And we have an opportunity for them to get involved right now, and we need them to do so.
If tight budgets and reduced services are the new norm, isn't it time we had a new big conversation around our expectations of health?